Our case study surrounds a 27-year-old female patient who was involved in a motor vehicle accident. She was a restrained driver traveling approximately 50 miles per hour. She was driving intoxicated through a construction area, and the patient's vehicle hit a worker before colliding into a barricade with the front driver's side of the vehicle. The patient was extricated, stabilized, and immobilized with a C-collar and backboard by EMS. An 18-gauge peripheral IV of 0.9 normal saline TKO was established. Upon arrival to the emergency room, our patient Mary Jo was promptly assessed by the emergency room RN, MD, and trauma surgeon. Vitals were stable and the patient was alert and oriented, but admitted to having a few drinks and showed great concern for the well-being of the construction worker. The patient denied any loss of consciousness. Upon initial assessment, it was noted that the patient had redness across her chest near the seatbelt line, and her left lower extremity was short and externally rotated. An EKG was performed, labs were drawn, and radiology was obtained. The emergency room physician ordered a CBC, CMP, alcohol, and urine drug screen. The patient had a stat head, neck, chest, abdomen CT, and a left hip and pelvis x-ray. Mary Jo stated that her only medical history is depression and denies any surgical history. She takes birth control daily, is a daily smoker, and drinks occasionally. She lives with her husband Billy Bob, but has no other family or friends in the area.
Hi, Mary Jo. I'm Christina with the Nurse Clinical 730. How are you?
Hi, Christina. I'm good. How are you?
I'm good.
Hi, I'm James. I'm having PCT. I'm going to take your vitals real quick.
Nice to meet you, James.
So on a scale from 0 to 10, how would you rate your pain?
My hip's probably about a 9, and I got a mighty bad headache today.
Okay, I'm going to listen to your lungs and heart, and then I'm going to give you a little bit of pain medicine, okay, while James is taking your vitals.
Blood pressure is 125/82.
Move your beautiful hair.
I had a salon appointment, but I had to cancel because I've been in here, so I missed it.
Can you move forward a little
Yeah.
bit?
Mind if you open your mouth a little and take your temperature? Thank you.
Okay. And back.
All right.
98.6.
Yeah, I'm going to listen to your bowels.
Sounds good.
And your oxygen saturation is 98. The pulse of 88.
Sounds all right, huh?
Mm-hmm.
Okay.
Okay, I'm going to take a quick look at your hip here.
All right. It's mighty tender, I'll tell you.
All right. Let me check your pulse on your foot. Okay, Mary, can you verify your birth dates?
And my name is Mary Jo Suellen Poppins. My birth date is 08/16/91, or excuse me, 87.
Yeah, 87. Okay, my alcohol swab, which I don't have. I'm going to give you a little bit of morphine.
Don't take care of the pain.
Yes.
All right. Ooh, it's tingly. I can feel that in there.
Yeah. You'll be feeling fine in just a little bit.
All right, that sounds good.
Dr. Lisette will be in here to see you. Explain your surgery.
Okay.
Knock, knock.
Hi, doctor. How are you?
Hello, Mary. I'm okay. How about you?
Doing all right. Been better.
Oh, I bet. So, because of all that trauma, it looks as though you have a cracked femur. Your left femur is cracked, which is your upper thigh bone on the left-hand side.
That's probably why it hurts so bad, huh?
Yeah, that would cause a lot of pain. I brought your x-rays here. So basically what I recommend at this point is a surgery called ORIF, which is your open reduction and internal fixation of the left hip. Basically, to sum it up, what I would do is I would go ahead and make an incision in your left hip area by the upper thigh, and then I would take care of that fracture with a plate, and then that plate gets held by screws. So I screw in, just screw right into the plate basically, and that will hold the fracture and the broken bones together.
That's good.
Okay. And if we don't do surgery, unfortunately, the fracture is just going to get worse. So it's up to you on what you want to do, but that's my best recommendation for you at this point.
What are the risks and complications?
Well, with any surgery, there's always a risk for infection. However, after surgery, we're going to go ahead and give you an antibiotic IV. and actually before surgery as well. So while you're under with anesthesia.
I read that you were a smoker.
Yeah, I've been smoking for probably like 5 years now.
Drinking?
Yeah, I drink probably every day.
Are you on any medication?
The pill.
No.
Alright, so you also have a risk then for blood clots, especially since you are a smoker and you are on birth control. That makes you higher risk for blood clots. So I'm going to give you a blood thinner as well after surgery, and that will prevent any blood clots from forming. And you're going to wear a device called SCDs on your legs as well.
Okay.
And it's just going to help with circulation as well in your legs,
All right.
since you can't be moving around as much. The recovery process is about 2 to 3 weeks initially, and then it might take a few months for you to actually get into the swing of things again. But as long as you're compliant with everything, the healing process should be just fine. All right, do you have any questions or concerns for me?
You gonna be there, right?
Of course. I'll
All
be the
right.
one doing the procedure.
All right, I'll be okay then.
All right.
Yeah.
So Christine's going to have you sign a consent, and I'm going to meet you back in the OR, all right?
All right, that sounds
All right,
good.
I'll see you back there, Mary.
Thanks, doctor.
All right. Thank you, Christine.
Okay, Mary. You need to sign this consent for surgery.
All right.
And I'm going to hang your antibiotics.
The patient was prepped for surgery. A Foley was inserted, her EKG was reviewed, and pre-op labs were drawn. Antibiotics were started prior to the surgical procedure. The ORIF was performed the following day without incident. Mary had an initial evaluation by physical therapy and began therapy that same day. Mary's condition continued to improve until 36 hours later.
So we're going to keep working on those exercises that we've been doing for the last couple of days.
Okay.
You're going to lift and hold. A couple of seconds. Bring it back down. Now wiggle your foot. Back and forth. Can you do that one more time? Mary Jo, so
I'm having.
shortness of breath.
Yeah.
All right, I'm going to sit you straight up, okay?
I feel like
Here's some slow deep breaths.
there's an elephant on my
I'm
chest.
calling your nurse, Christine.
Yeah?
Hi, can you come in? Your patient, Mary Jo, is very short of breath. We need you right away. Okay, so pulse ox is 89.
I can't breathe.
Okay, slow breath.
What's going on, Mary Jo?
I feel like there's a big elephant sitting on my chest.
Okay, can you call respiratory? I'm going to put some
I
oxygen.
can't hardly catch my breath.
Relax.
Hi, Mary Jo. I'm Jen from respiratory. I'm going to do a quick assessment. Can I have you sit forward? Left lower lobes diminished.
Hi, Dr. Lissette, this is Christine, the nurse taking care of your patient, Miss Mary at the Chamberlain Hospital on 4 East in room 410. Mary was admitted 2 days ago with left hip fracture. She had an ORIF with no complications. Approximately 5 minutes ago, Mary became suddenly short of breath with respirations at 40 and her O2 dropped to 89% on room air. We placed her at 15 liters and she's now up to 93%. Her heart rate is 130 currently, her blood pressure is stable at 118/68 and she is afebrile. Mary has a history of smoking and takes birth control daily. Mary is complaining of difficulty taking a full breath and she has diminished lung sounds on the left. Yes. Okay, so you would like me to put an order in for a chest x-ray, a CT to rule out a PE, and a repeat of labs including a D-dimer, troponin, and obtain AB and EKGs, correct? Fantastic. You'll be here in 5 minutes? See you then. Thank you.
Mary's X-rays and CAT scan showed an RV dilation and pulmonary embolus that began in the left pulmonary trunk. No pulmonary infarction was seen. It was noted with the repeated labs that Lovenox injections were subtherapeutic. The patient was started on IV heparin. Mary Jo continued working with PT, OT, and social services. Mary Jo's condition continues to improve and she was discharged 7 days later.
So Mary, you're going to be discharged today. Do you have any questions or concerns for me at all?
I don't think so. You guys have been great.
Alright, so how's your pain?
Pretty good. Probably like a 1 or a 2.
Okay, very good. So you're going to follow up with physical therapy. Christine's going to go over paperwork with you for your discharge.
Okay.
And I want to see you in my office next week, okay?
Sounds good.
Alright, so best
Thank
of
you
luck
so
to
much,
you. I'm
doctor.
glad you're feeling better. I'll see you later.
Have a good day.
Okay, Mary Jo, here you go. We went over this already, and I just need you to sign. Here's your appointment for next Friday.
All yours.
Hi, Mary Jo Swellen.
It was a pleasure
it's good to
taking
see
care
you.
of you.
Thank you so much, Christine.
I have your paperwork here from social services.
Okay.
Did you have any questions about what we talked about earlier?
I don't think so. All I need is that referral for the counselor,
This
right?
is the referral. There's some phone numbers on there if you need to contact anyone.
Okay.
Okay?
Looks good.
All right, and you know you're going to be in rehab for about 1 to 2 weeks? All right, anything else I can do for you?
I think that's it. Thank you so much.
Thank you so much. Nice meeting you.
You too.
Take
Have
care.
a good day. All right.
All right, ma'am. It's time to go.
Hold on, let me get up first. Good job. Okay. All right.
Hi, Mary Jo.
Bye, Christine.
Mary Jo was charged with the DUI. The construction worker she hit remains in stable condition. Mary Jo posted bond and was transferred to a rehabilitation facility. Her court dates are still pending. She has follow-up appointments scheduled at the Chamberlain Clinic and is deciding on an IVC filter in the meantime.
Bad boys, what you want?